Good evening, everyone, and welcome to another hour of Healthy Conclusions, where we try to give our listeners important information on nutrition, exercise, and holistic, alternative, and integrative medicine. Please take a minute to visit our website at www.healthyconclusions.com and like us on Facebook. My name is Bob Neugebauer, and I will be your host for this evening's show. Tonight's show is being brought to you by Altrua Health Share, which has been serving its members and their families with their health care needs since 1997. Please take a moment to visit their website at altruahealthshare.org or call 888-244-3839 to see just what Altrua Health Share can offer for your family's health care needs. It could mean substantial savings. Tonight we are going to discuss the difficult subject of mental illness with two of our local doctors, Dr. Corinne Bottrell, who is a doctor of naturopathy and is an educational clinical psychologist and consultant. Dr. Bottrell has also worked as a psychologist in a California maximum security prison for 5 years and was a forensic evaluator at the Snake River Sex Offender Treatment Center in Ontario, Oregon. Dr. Jeff Hartford is a former medicine doctor in Boise who is a naturopath with extensive experience in addiction and its treatments. So welcome, Dr. Bottrell and Dr. Hartford, to Healthy Conclusions, and thank you for taking the time to be with us this evening. I chose this subject for this evening's discussion because of the nationwide discussion currently going on about the role mental illness has played in mass shootings and how they might have been short-circuited with proper intervention. So let me start with the first question, and again, these questions are for both of you. First, I would like to ask you how you would determine mental illness, because I'm not sure how to define it. And how would you characterize it or properly diagnose someone that is mentally ill?
Well, Bob, unlike diabetes or cancer, there is no medical test that can provide a diagnosis of mental illness. A healthcare professional can do a number of things in an evaluation, including a physical exam to rule out any underlying conditions that may be causing symptoms. Once medical conditions are ruled out, the Diagnostic and Statistical Manual of Mental Disorders is used to make a diagnosis. The DSM-5 is published by the American Psychiatric Association and lists criteria, including feelings, symptoms, and behaviors over a period of time that a person must meet in order to be officially diagnosed with a psychiatric illness.
Dr. Hartford, do you have anything to add to that?
Sure. My experience in the field of psychiatry is different than Dr. Bottrell's. I was a rural country doctor up in Council and Cascade, which means I also had to go to the jails in Council and Cascade and see people on holds either for psychiatric illness or drug abuse or drug withdrawal or a combination of all those. But then I also was a medical consultant here in Boise at Intermountain Hospital for 10 years. I left the prescribing and the psychotropic meds to the psychiatrist, but then I had to deal with the side effects caused by those medications like diabetes, high blood pressure, hypothyroidism. And so my definition of mental illness is it's a disease of the brain, and people have trouble defining their reality. And so it's an illness for a person who's uncomfortable in their own body or in their own mind dealing with the reality we have in our community, on TV. I think a great recommendation for anybody with anxiety disorders, and excuse this on a radio show, but don't watch TV and don't read the newspapers. They're bringing things to your mind that are very remote, but they tend to occupy it. So I think sometimes mental illness is just more of a social problem where people are acting out on their different reality, and it causes problems for all the rest of us in society, and sometimes that's taken to horrific ends, but a lot of people are medicated and put in hospitals and institutions to keep the public safe, and so that's also a definition of mental illness.
You mentioned the drugs, and I'm just curious: are they becoming more of the problem than they are the solution?
I really think they're more of a problem. if you look at just in the short time I've been practicing medicine for 30 years or so, all the new medications that have come out, and then often in psychiatry, you have to add medications to be able to get a person to even take that medication for whatever reason, side effects. And a medicine can be deemed safe by the FDA and the pharmaceutical company and then be released in the market until we discover, oh, no, that's not true. The whole OxyContin issue and addiction is kind of a shining example, but lawsuits and damaged health due to the metabolic side effects of Seroquel and Haldol are astounding.
What are some of the causes of mental illness that you've observed in your time as doctors?
Head trauma, abuse, poor nutrition and diet, inflammation, toxic environments, lack of exercise and social isolation, even lack of sleep or poor quality of sleep can manifest as symptoms that get diagnosed as other disorders such as depression, anxiety, and even ADHD. Neurotransmitter imbalances may be the underlying cause of certain kinds of mental illness and even schizophrenia. But there is little doubt that nutritional and biochemical imbalances play the largest part in mental illness.
Jeff, do you have anything to add to that?
For the causes of mental illness, I guess one cause that I've kind of weeded out is the whole genetic issue. I kind of believe in epigenetics now. It's what we do with our lifestyle, like exercise, the type of diet we follow, that can change our genes and manifest different types of mental or physical illness. So genetics I don't put up there as a reason, although I can tell you in the allopathic field, if you have someone in your family, then you're probably going to get it too.
Well, the lifestyles that we live nowadays, evidently, depending on how you live them, is going to determine just how you are affected mentally. Does biology of the brain predispose someone to violence?
When we study the anatomy of violence, we are faced with the genetics versus environment argument. Just as Dr. Hartford mentioned, we do know that shaking a baby in infancy damages the prefrontal cortex, which is our moderator for social behavior. It also has an impact on the amygdala, the emotion part of the brain where conscience, guilt, and remorse is developed. Even lead exposure and alcohol during pregnancy alters brains in utero. By studying the state of mind of perpetrators who are responsible for the horrific tragedies of Columbine, Las Vegas, and even the most recent in Florida, we have discovered a common thread. These people are often embittered by life or outraged and search for revenge. Oftentimes there is a long time of brooding that increases their hatred. Sometimes they seek notoriety and engage in competition to other mass murders. Their brooding on one's misfortune or isolation fuels their dark, tortured thoughts of destruction.
Do you find, either you find that the intention of these people who have these problems is more suicidal than it is to be a mass murderer, and that's just kind of incidental? Or do they run threads together?
I think threads are combined. I'm afraid some of these individuals that act out in this way, I'm sure they have asked for help in ways before and were either ignored or didn't get the appropriate attention, and so they watch a movie, they watch some TV, they get some ideas how to get more attention. And these days with social media, everything's on YouTube, national news, Facebook, almost instantly. And so I think these horrible displays of violence are a cry for help from that individual.
Well, if these people are crying for help, why is it that we don't have the faculty and the facilities to handle some of these problems, or is it just that we tend to ignore them?
I think we tend to ignore. I was thinking of an interesting story. When I was a medical student at the University of Washington, I did my inpatient psychiatric rotation at the VA hospital on America Lake in Tacoma. It was beautiful. And at the time I was there in the early 80s, they were in the process of taking the largest inpatient psychiatric population in the country, which is 600 veterans, who are doing remarkably well on a token society, which means they got up, they ate breakfast, they made their bed, they took their meds, and then they got some chips that they could exchange for time to play pool or cigarettes or different, they had a little store, they could buy things. And these veterans function so well in this community. And so at the time I was there as a medical student, the big push was, this is way too expensive. We got to get these people back out in society. And so they were actively discharging people who would go to not a very good living situation, stop taking their meds, act out, were quickly brought back in the hospital. And it'd take weeks to get them stabilized again, just to discharge them again. And so there are individuals that prefer to live in a safe place, whether it's the psych hospital on American Lake in Tacoma or up in a little cabin by Yellow Pine. They're safe there. They interact with the parts of society. And I think a lot more people should get out of the city, get out of the rat race. Reality's a lot different.
But when we talk about our medical system, it seems to be broken in many ways. This may just be part of it. We're going to have to take a quick break, but we'll be back in a few minutes. You're listening to Health Conclusions, brought to you by Altrua Health Share with your host, Bob Neugebauer, on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Drs. Bottrell and Hartford on mental illness, sponsored by AltruaHealthShare.org. So let's get to the next section here. We know that some of the perpetrators of the recent mass shootings were either taking psychiatric or psychotropic medications or withdrawing from them. In this case, could these drugs have caused or altered these perpetrators' minds so much that they didn't know what they were doing?
Good question, Bob. Psychiatric drugs are more dangerous than we believed. 1 in 5 people take psychiatric medications, and based on the medical records of those who have committed mass shootings, research has shown a link between psychiatric drugs and school shootings. The known adverse effects of some of these medications include suicide, violent behavior, aggression, and homicide. Dr. Hartford mentioned a few of the psychotropic meds earlier, and we know that Prozac can cause violence, mania, and even psychosis. Stimulant medications in children can cause shrinkage of brain tissue. The benzodiazepines or tranquilizers such as Xanax and Ativan are highly addictive and are difficult to get off and can also cause shrinkage of the brain and memory loss with long-term use. Even the atypical psychotics cause metabolic syndrome, diabetes, increased cholesterol, and induced heart arrhythmias, like Dr. Hartford mentioned. Often these drugs produce a biochemical imbalance that did not exist prior to starting on these medications. Most of the perpetrators of mass shootings are very much aware of what they are doing. Often their crimes are not impulsive and a result of a thought-out, planned attack.
I'd really like to broaden the definition of a psychiatric medication to any medication that might have an impact on your mentation or your thinking. And so we have to go to Benadryl. And so you take Benadryl if you itch, you take it at night if you can't sleep. You do not think as clearly the next morning, and you don't get normal cycles of sleep. And then there's other medications like Chantix, which is used to help people stop smoking through a mechanism of the neurotransmitters. And there are warnings with Chantix. Don't drink alcohol, don't do other drugs, because you're basically going to be in a blackout and do crazy things. Someone will come knock on your door and you'll feel threatened and you'll shoot somebody before you open the door. So Chantix is in that ballpark. Pharmaceutical companies release different generic drugs like fluoxetine, which is Prozac, under other names. They had a preparation which was for PMS called Serafem. I believe they've done the same thing with bupropion. They use it as an antidepressant or for smoking cessation. So that term of a psychiatric medication, some capsule or pill you take that affects your brain is very broad, and it includes alcohol and caffeine and power drinks, and so many of the things in our environments are psychoactive. And if you go to your allopathic medical doctor, their choice is to give you more things that change the way you think.
Good point.
Dr. Bottrell, I know that you are very active with children with ADD, with autism, and that's kind of been a career for you in some ways. The drugs that they're giving our kids in school for these ailments, or the ailments they say they have, are these probably the beginning of the kickers to get them started on these things and get them into that state of mind that we're seeing happen? Are they the beginning of it?
Certainly for some. There's several schools of thought. Some believe that if you put a child on stimulant medication to help them cope with their overactivity, that when they become adolescents and they've learned skills to manage their behavior, they're less likely to get involved in illicit drugs. However, there's also studies to show the absolute opposite of that as well. Children sell their stimulant meds to their peers in school. That's really quite common.
So we've actually got the distribution going on between our kids and school.
Yes.
And how do you stop that?
It's not just the kids. I heard a story of a little old couple in eastern Idaho. They'd go into the doctor with their pain complaints. They'd both get their big OxyContin prescriptions, and then they would sell it to a young person who could get $10 per milligram. So 80 milligram OxyContin is $80. And this little old couple would take advantage of Medicare to go to their drug dealer and then sell it to somebody that ended up on the street. So
And maybe that's the new supplemental Social Security that we've been talking about.
I don't think we're supposed to talk about it publicly, but I'm sure it's implied.
I'm sure about that, too. How do you think we should be addressing the mental illness issues of Americans, and in particular children? Do you think there should be psychological screening done on the school children to catch any problems before they become radical?
Good question. In a recent study that I was reading of 29 economically advanced countries, the U.S. ranked 26th in child well-being. That is absolutely disgraceful. The medical system in our country is truly broken. Our first step should be to transform medical care to health and wellness care. A network of people and places that build health, prevent illness, and fix us when needed. This transformation requires teaching people how to be healthier by integrating a variety of different strategies to cure rather than manage disease. Too often, drugs are being prescribed instead of changing the factors that cause and perpetuate illness. We need to focus our attention on families and communities by expanding mental wellness services. There are many nutritional and integrative interventions that have proven successful for mental health disorders. Educating people on proper healthy nutrition is certainly a good start. Bob, to answer your second question, there is a protocol in place within schools that if a student has violated district policy or district rules, a psychological evaluation is administered to assess the risk of having that student on campus. I have done hundreds of risk assessments in the 18 years I worked in the school system. However, it has been my experience that this protocol is not necessarily followed in all districts and other states.
So are you talking that some places do it and some don't, and it's basically at the discretion of the school boards?
Yes. It's also been my experience that nobody wants the liability of making a statement that a child is at risk of harming others, and therefore they are excluded, and then they're looking at the potential of lawsuits. And that's why I ended up with the majority of risk assessments, because there was concern by other professionals. They didn't want that responsibility.
So
and that
how do we
liability.
change that? I mean, what do you do to change that?
I think the climate is different now with these shootings, and I think it should be mandatory. I think that there shouldn't be an issue or concern about lawsuits and liability. I think if a child is in danger of harming themselves or others, that we have to take the next step and make sure that that child is protected, as well as the safety of the community.
Do you have anything to add, Jeff?
Not to that topic, no.
Drugs are in many cases indiscriminately prescribed in this country to patients without knowing what effects they will have on them. Isn't there a better way to deal with people that are having mental difficulties than drugs, or is it just that we don't want to take the time or the energy to get to the root of their problems?
I'm really struggling with this question as far as thinking about indiscriminately prescribed. I think every prescribing physician understands that there's a medicine container in someone's medicine cabinet in their bathroom with their name on it, and I can think of a few successful overdoses in people using tricyclic antidepressants prescribed by practitioners. I didn't think they realized the significant risks of being on such a high dose. And there is so much information. I can see why allopaths tend to specialize. I loved being a general practice doctor because I was able to take care of children, the elderly. You could see the effects long term, and with the doctor having to just focus on one specialty and not think about other ramifications, it's a pretty confusing topic. I think there is a better way, but it takes more time, more effort. It's going to cost more money. It's not going to be a quick fix. I'm afraid some big institutions like pharmaceutical companies aren't going to be able to continue to make their investors happy. And more families are going to have to own the problems in their families and deal with it in the families instead of dumping an issue onto the doctor or the psychiatrist or the school counselor. We're all going to have to expect more responsibility for people in our lives.
Thank you very much. We're going to have to take a quick break, but we'll be back in a few minutes. You're listening to Healthy Conclusions, brought to you by Altrua Health Share with your host Bob Neugebauer on 580 KIDOAM, 107.5 FM. Welcome back to Healthy Conclusions on 580 KIDOAM and 107.5 FM. We're speaking with Doctors Bottrell and Hartford on mental illness, sponsored by AltruaHealthShare.org. All right, so let's talk to you. Both of you are naturopathic doctors. As a naturopathic doctor, what do you consider the underlying causes of depression?
Well, Bob, depression can be caused by a multitude of factors. Lack of serotonin or irregular production leads to mood disorders. Head injuries can result in depression. Even anger turned inward can cause depression. But before I determine the cause of depression, I first ask questions such as, is the thyroid functioning optimally? Does the person eat and digest adequate protein? Does the person need supplemental B vitamins? What role does their level of stress play? Is vitamin D level optimized? Does the person get adequate amounts of refreshing sleep and exercise? Does the person experience chronic pain? Those are all questions that lead to coming to some conclusions. But after ruling out a biological reason for a mood disorder, we explore the individual's history and life circumstances, such as loss of a loved one or job, or other factors that may be impacting their current state of mind.
I agree with Dr. Bottrell's list. I think hormones have an impact. Obviously, there's conditions related to depression, like PMS, like roid rage in men that excessively supplement testosterone.
Yes.
As an allopath, I always thought about neurotransmitters but I never thought about the biggest source of neurotransmitters is not our brain, it's our gut. And so, the cause of depression is our poor diet and what we've been taught to eat. I was thinking about 1% milk. 1% milk is when you take all the good part out of the milk, which is the butter and the cream, and then you have a waste product which they marketed into the best form of milk to drink, which is 1%. Why not get those healthy whole fats in whole milk? But we're all taught that way. Maybe a low-fat, high-carbohydrate diet is a cause of depression. And then it's certainly related to our environment. As an allopath, I thought about heavy metal poisoning as obvious neurological illness, but I'm sure there are people walking around with high levels of aluminum from environmental exposure. Here in Idaho, all of our water has passed through ground. We're the gem state. They took gold and silver out of the state, and they left the arsenic and cyanide, and it's all at the bottom of our reservoirs. So I think a big part of depression is heavy metal toxicity. And then you're going into that whole talk about infectious disease aren't the big enemy anymore. It's our environment. It's heavy metal. So maybe we should all think about stop vaccinating because aluminum's in there as an adjuvant.
Well, how do you feel about stress, and what part does that play? Because I understand it plays a part not just in your mental capacity, but also in your digestive abilities, and affecting what you eat, how you eat, what your lifestyle's like, the stresses that you have every day. How does that play into this in terms of mental illness?
Well, thinking about any neuropsychiatric condition like dementia as a blood sugar problem, or if you look at the metabolic side effects of the antidepressant and psychotropic medications, they tend to cause diabetes, they cause blood sugar problems. The high-carb diet that we eat, it just pushes everybody to remain hungry, to remain wanting, to never be satisfied. And after you eat your big fast food meal and then you had your little squirt of dopamine in your brain, you're not happy again. And so I think the lives we lead in this society, having spent time in India where everyone's poor, everybody doesn't care, and you come back to this country with road rage and shopping and Black Friday, and we all push each other. I guess that's the capitalist way, but the children are suffering, and the poor individuals that have no other avenue to vent other than making threats and then acting on those threats to be heard on Facebook and national news. It's part of the stress we live in.
So the problem is a lot larger than most of us realize. If you're talking about what we're eating and how we're going about our lifestyles, this is a societal problem. This is something that's been brought on over years, and I don't see how that's going to be rectified anytime real soon. Do you have a solution for that?
I think it can be rectified and solved for each individual. So it's going to have to be a grassroots effort, people who care about their family and their health, and they're not going to hold sway to mass marketing or, commonly held beliefs are going to have to be examined and changed.
I often think that maybe the food companies are trying to kill us all with all of the garbage that they put in some of these food, especially the processed foods. What are some of the naturopathic treatments for mood disorders as opposed to those that would be used by allopathic physicians that you're familiar with?
One of the treatments I'm really excited about, and of course it takes me back to the 80s when I was doing work in biofeedback. Dr. Petrell and I work at Energetic Health Center up on Orchard with Katie Packwood, and we're all just fascinated by neurofeedback, and we can do brain maps on people, and everybody has an imbalance between the right side and the left side of their brain, and part of that might be brought on by speaking on cell phones, that electromagnetic charge. But if the balance of the brain waves on the right side is not right, then you tend to feel anxious. If the balance on the left side isn't right, you tend to feel depressed. And doing biofeedback, we can retrain our brains. I think our mind is separate from our brain. Our brain is an organ. And there are types of intervention and meditation techniques, breathing techniques that heal a body, get a body to make normal levels of its own neurotransmitters. We teach children and people to meditate and be able to inhibit socially inappropriate conditions, so it helps with ADD in the classroom. It probably helps with people's interaction in society, such as road rage, even to the point of, shooting hundreds of people.
So how long has this neurofeedback been in existence that people have actually been using it, and why isn't it used more?
It came to light in the 80s. There was a lot of work by Elmer Green at the Menninger Foundation in Kansas. And it takes some time, and you have to get your child out of school to go do it. It's not as easy as just giving them a pill in the morning. And then I think the FDA and the forces that are looking for a quick fix through medications tend to downplay non-invasive, natural things which are effective.
As naturopathic physicians, you would not be prescribing drugs for your patients, but instead you'd be using nutrients. Could you tell us what types of nutrients you would use to treat a patient you considered mentally deficient or ill?
Bob, I'm likely to recommend several vitamins and minerals that are supportive for mental health. Zinc is the most common deficient mineral and most critical nutrient for mental health. Zinc deficiency is associated with schizophrenia, depression, anxiety, anorexia, hyperactivity, and even behavior disorders. The next recommendation is a B-complex vitamin, which is a foundational support for all cases of depression. The B-complex vitamins are necessary for optimal neurotransmitter production. And we know that insufficient B vitamins compromise our ability to cope with stress. We also know that low levels of vitamin D are associated with higher rates of depression and seasonal affective disorder. It is always recommended for people to get their vitamin D levels tested, and if they are not in optimal range, supplement with vitamin D3. Next, we have found that 5-HTP is very beneficial in the treatment of depression, anxiety, bipolar, and hormonal.
What is that now?
5-HTP?
Yes.
It's an over-the-counter supplement that works on the neurotransmitters, and we find it very, very useful.
It's a precursor that our brain makes into the neurotransmitters, serotonin, dopamine, or norepinephrine.
Another essential nutrient for mental health that is very commonly deficient is magnesium. Mental and emotional signs of possible magnesium deficiency include anxiety, panic attacks, irritability, ADHD, poor sleep, anger, heightened sensitivity of pain. And lastly, Bob, the use of ashwagandha, an adaptogen herb, is also helpful when anxiety, oversensitivity, and irritability are the primary symptoms. I do believe that nutritional supplements can be very useful in alleviating many of the characteristics of mental disorders. However, they should be considered supplemental to a healthy diet and exercise. But for supplements to work, we first have to build a strong foundation of diet that can absorb these nutrients. And I agree with Dr. Hartford. Neurofeedback has been shown to be highly effective in treating certain mood disorders as well, and we are seeing excellent results at our clinic.
We have to take a quick break, Doc. We'll come right back to you. We're just going to be gone for a few minutes. You're listening to Healthy Conclusions, brought to you by Altrua Health Share with your host, Bob Neugebauer, on 580 KIDO AM and 107.5 FM. Welcome back to Healthy Conclusions on 580 KIDO AM, 107.5 FM. We're speaking with Doctors Bottrell and Hartford on mental illness, sponsored by AltruaHealthShare.org. Doc, you were about to say something before. We were talking about nutrients and how they are beneficial in helping those who are mentally ill.
I was excited to hear Dr. Bottrell's list because I agree with everything on there. The only little things I would add, it's amazing what impact we can have on brain activity and muscle activity with appropriate mineral supplementation. So I agree that zinc is deficient, magnesium is deficient. Here in Idaho, we know more about it in our livestock, but we just don't have selenium in our soil here, so that is an important supplement for prevention of neurodegenerative conditions and to promote a healthy immune system. Omega-3 fish oils are huge, but if you take that to the point of eating grass-fed organic meats, a lot of the vitamins that we supplement, animals are supplementing too, and then they pass them on. I'm not going to get into the whole vegetarian, we shouldn't eat animals discussion, but this low-fat diet is keeping us all deficient in vitamin D, vitamin A, vitamin E, and so starting to look at other approaches like a ketogenic diet, which is high-fat, and I don't think a blanket diet recommendation for the whole population is appropriate. I think people should realize how sensitive they are to glucose in their diet, and if they are, then they should quit eating the carbs and get off into a high-fat diet, ketogenic diet. If you're not intermittent fasting, however, if you're not eating, then you're going to need to take some supplements that provide the plant-based nutrients we need as antioxidants and to promote normal nerve functioning, including normal function of our brains.
Thank you. Do either of you believe that some patients are just beyond help and need to be institutionalized, or is there always a possibility of turning a patient around?
Bob, I don't believe anyone is beyond help. There's always something we can do to alleviate suffering. I believe given the right diet, nutritional supplements, exercise, therapy, and exposure to sunlight, that most people will experience improvement. Having said that, I also believe that evil exists in the world, and for those diagnosed as criminally insane, psychopaths, or even untreatable pedophiles, institutionalization may be the only alternative to keep society safe.
What do you think about that?
I think there should be places for individuals to live where they're kept safe and society is kept safe. And if an individual is most comfortable in there, then there should be ways to keep them in there. If you think about Shawshank Redemption, those prisoners who had been in jail their whole life had no idea what it would be like on the outside. And I think it's true for some people with psychiatric illness. They're in a safe place, they're taken care of, they're heard, they're listened to. They don't want to be thrust out into society. It's more expensive, but it's a much more humane approach to both the individual and to the rest of society.
We seem to have closed up most of our state hospitals. We used to have quite a number of them throughout the states where we could put people in safe places. It seems like they've gotten away from that, and nobody really wants to handle this problem anymore. Is there an alternative, or is there another way that we could do this?
I don't know what I don't think having everyone cared for at home, I think it's the best thing, but if all the children with Asperger's or autism that need constant care, and now all us baby boomers that need care for dementia, if we're kept out in the home, I think it's better for everyone involved. I remember when I first came to Boise to do residency, they had the Nampa State School for Children, and they had some profoundly retarded individuals. Some of them had PKU disease, which is an amino acid problem. There was a 12-year-old with hydrocephalus, this big, huge brain, but basically profoundly retarded, that needed constant care. And so I think in the setting where they get some care, there needs to be some types of institution.
So we should be bringing more money back into the institutionalized entities if we're going to really take care of some of these people.
I think it's a better way to really take care of people than to let the pharmaceutical industry treat everybody with straitjacket medications.
Mm-hmm.
Why is it that instead of treating a patient who has mental illness with therapy sessions, we always seem to revert to the use of drugs, which in many cases make the patients worse? Is it because it's the simplest format for doctors? Or is it just that the allopathic difference between allopathic, naturopathic are that much different? And should we get to an integrative medicine where we start to look at both sides?
I think, Bob, it is easier, it's expeditious, and certainly less expensive to prescribe medication than spend time in talk therapy and resolving underlying pathology.
And I think an integrative approach, especially if everybody goes back to focus on the foods that they eat and the foods that they avoid, I think is going to have a bigger impact on this nation's mental health than relying on drugs.
How do you think we could change our medical system to acknowledge the fact that we have many more cases of mental illness than we would like to admit to, and how could we do a better job of helping those people get back to a normalcy when we have such a shortage of physicians and the payments for treatments seem to contract each and every year, especially when it comes to government programs like Medicaid?
Mm-hmm. I think we need to focus our intentions on families and communities by expanding mental wellness services. There are nutritional and integrative interventions that we know have proven successful for mental health disorders, and educating people on proper and healthy nutrition is certainly a good start. It would be helpful if the government made mental health a priority, and if insurance companies supported health and wellness programs that are proactive and preventative. We wouldn't have the major issues that we have today.
Do you agree with that, Jeff?
I totally agree, and I don't think I have anything to add to that.
So basically, we need to get back to the health and wellness part of this scenario than the fixing the broken. Mm-hmm. Because if you fix it first, you don't have anything broken later.
Mm-hmm.
Totally agree. Well said.
But how do we get the insurance companies to understand this problem? You know, I know right now there's a big battle going on for integrative medicine to take a part in the opioid crisis, and that this crisis has gotten to be so insurmountable that nobody wants to take ownership of it. And as we're seeing, even President Trump has gotten into the fracas. But if it's a simple matter of nutrition and people understanding what they should be eating and not be eating, it becomes an educational situation. And that means you have to bring the education to the people. And that's going to be a problem, because I don't see how you're going to do that. A lot of people don't care to learn anymore.
I agree with that. That's sad but true also.
Yep.
You both know that I'm a big fan of integrative medicine. Do you think we would get a better result of treating patients with a more integrative approach, kind of like the things you're doing at your clinic?
Well, Bob, there will always be those cases in which traditional medications might be the only option, say in controlling seizures or managing a psychotic episode. I would like to see alternative medicine practitioners work more closely with the medical profession so that when medication is needed, that the minimal dose is used to reduce the symptoms for the least amount of time. I believe by treating mental disease by balancing neurotransmitters and body chemistry with nutrients, minerals, neurofeedback, exercise, energy medicine, they all will significantly improve our quality of life and our overall well-being. It is much safer and avoids drug dependency.
And again, the name of your clinic?
Energetic Health Center on Orchard Street up on the bench in Boise.
I want to thank you both for coming here this evening. This is Bob Neugebauer signing off on Health Conclusions. We hope you'll join us again same time next Sunday for another hour of informative talk about nutrition, exercise, and alternative medicine options, sponsored by AltruaHealthShare.org on 580 KIDO AM and 107.5 FM.